Well, a warm welcome to today's talk, Monday evening, the 7th of March. Going to be looking at some data from the UK shortly on unnecessary deaths. And this is going to apply to most countries, so it's quite interesting. But let's look at a bit of orientation first of all, to see where we are number-wise and generally what is happening. So these are new daily confirmed cases. Now, of course, we know there's testing difficulties here that can distort these, but the United States, the cases are definitely down. The United Kingdom, this slight uptick here is actually genuine. There has been a slight increase in the United Kingdom, as we'll see. Australia going down in the east, but going up in Western Australia. Now, Denmark, which of course is one of the first countries to lift all legal restrictions, the cases went up dramatically, but now they're going down dramatically, and I'm sure this trend is going to continue downwards, whereas New Zealand, cases going up, and Hong Kong cases just starting to level off. Now, I have had some interesting correspondence from Hong Kong, so I'm going to be sharing those with you later. But let's carry on with the general picture first of all. Reproductive number, so there's the one there, remember. So when we look at it, the United Kingdom actually has gone to an R value of just above 1. Denmark and the United States much lower, so they're going to carry on going down quite quickly. Australia is above it, but New Zealand, well, as we know, they're entering into their main Omicron wave as we speak. Number of COVID patients in hospital. Now, sadly, I don't know why the New Zealand data is not getting through to our world in data, but it's not for some strange reason. But anyway, hospitalisations as we have. Australia, slight uptick. United States, well, look at this dramatic decrease in the States. I mean, it's been frighteningly high, but just gone down consistently. The United Kingdom, again, that slight uptick there is genuine. A very slight increase in cases, but not many, just a few. And Denmark, well, we know in Denmark that so many people have been infected all the same time that the amount of people hospitalised with COVID, not because of COVID, is fairly high in Denmark. Incidental hospitalisations in Denmark are higher than other countries. So basically, I think that's a fairly encouraging trend that we're seeing there. Intensive care wise, well, again, the United States, dear me, things have been bad there. Look how high the intensive care admissions were. And of course, these graphs are all adjusted for capita. These are per million people or whatever, per 100,000 people. It's all adjusted. So United States going down, and United Kingdom intensive care has been going down consistently. Australia, again, low. Denmark, intermittent, but again, some of those in Denmark are what we might call incidental findings. And then new daily confirmed deaths per million. New Zealand, sadly, a few deaths, and that will continue to increase, albeit hopefully very slightly, but it will for some time because of the increased number of cases there. Australia, United Kingdom, United States, down as we know. Denmark, again, a lot of these are with rather than from in Denmark. And I'm afraid there's an awful lot of people dying in Hong Kong. And again, we'll look at reasons for that shortly. Now, let's go on and look at some Office for National Statistics data. We'll look at some written data first of all, and then we'll go on to look at some of the relevant graphics, which I'll just show you one relevant graphic now. We'll just I've queued that. Infections down. There's always a little out of date, of course. Now they've actually gone up a bit, so next week that will show a slight increase, but that trend is down. Hospital admissions basically down. Deaths decreased slightly. About 8 in 10 adults have had 3 vaccine doses. 9 in 10 adults had antibodies, well, 99.5. So a very large number of antibodies. I'm very dissatisfied with this antibody data, as we'll show later, because it is not differentiating between those who've had natural infection and those who've got those who've had natural infection-induced antibodies and those who've had vaccine-induced antibodies. For what we're paying the Office for National Statistics, they really should differentiate between those two. So that's unsatisfactory. But again, more on that in a minute. Social distancing basically down in the UK. In my experience, everyone seems to be behaving pretty well as normal, which is, of course, very good for developing herd immunity. Now, avoidable mortality rates at the highest level since 2010. This is concerning. And I believe this is the same in quite a few countries, not just the UK. So in 2020, 22.8 of all deaths in the Great Britain area were considered avoidable. Now, of course, this is not saying how much longer people would have lived for. It could have been hours, days, weeks, months, years, potentially decades. But 22.8% of deaths were considered avoidable. So this is not a good situation, as we see. It's the highest. It's been the highest for 2020 was the highest for 10 years, and of course 2020 was the main year of the pandemic, or one of the main years of the pandemic. This figure represents about 153,000 out of the total 672,000 deaths. And as we'll see, particularly in Scotland, one of the main reasons for this was alcohol and drug use, which is considered avoidable. And you could also consider deaths avoidable if they could have been helped by earlier medical treatment, but that's alcohol and drug abuse is one of the causes. More on that, we'll look at that graphic on that in a minute, but quite concerning. And we believe this is happening all around the world, so it could well be that in 2020 more people died from what we might call collateral damage than actually died from the infection. That is quite possible. That could transpire to be the case. And as we see in the UK, the figures are roughly comparable, probably slightly higher. People dying of unnecessary causes in the UK. Long COVID and mental disorders kind of follows on from that. This is in school-age children, so primary-age children. With long COVID, 30% had a probable mental disorder. So nearly a third of children in the primary age group with long COVID had a mental disorder, compared to 7.7% in those that had never had long COVID. And in primary age children, there's about 1% have experienced long COVID. So 1% of children, that's kind of the age 5 to 11, have had long COVID. So the numbers are small, but the proportion of those that have had mental disorder really quite high. Doesn't tell us what's cause, doesn't tell us what's effect, but it does describe quite a lot of human suffering, which is a problem. More on mental health to come. I'm looking more at mental health at the moment, and we will be looking at that. Secondary age school children, so that's like 11 through to 17, 18. 22.6 had a probable mental illness, so quite a secondary age children, but these are people with long COVID, so it's a lower number, 22.6 a probable mental illness, compared to 13.6, which is a higher number than the junior children without long COVID. So again, long COVID, as we see, does seem to be causing more psychiatric potential problems. And secondary age children, a larger number have had long COVID, 2.7%. So is there more mental health issues to come? It could be. And we've got a pretty big problem with mental health as it is, or lack of mental health anyway. UK prevalence, so still pretty high. England 1 in 30 people. Wales 1 in 30 people with COVID that week would have tested positive that week. Northern Ireland 1 in 17, and Scotland 1 in 19. So still a lot of COVID around. Let's look at a few of these graphics now, I think. So that was the overall introductory one. Now these are avoidable mortality rates increased for alcohol-related and drug-related deaths. So these are alcohol and drug-related, and they've gone up. Now, this is England here, where they've gone up a bit. That's Wales where they've gone up a bit more. I mean, there's certainly an increase. We can see there's an increase in 2020 there, but Scotland, dear me, there's an increase on an already very high amount. So avoidable mortality rates related to alcohol and drug deaths pretty high, with a sharp uptick there in 2020, particularly in Scotland. Now, there probably are lots of theories around as to why this is a bigger problem in Scotland. I'm not particularly aware of them, but it is significantly a bigger problem in Scotland. Significantly bigger. Now, we're looking at pictures, aren't we? Sorry. There we go. Let's look at some more. England, so this is the testing positive rate going down. As we say, it will be up in the latest week. This is the Office for National Statistics data. It's going down there. Wales likewise going down. Northern Ireland likewise starting to go down. But again, Scotland, strangely, still going up. So this could be because they had more severe restrictions earlier on in Scotland. So if you like, the virus is catching up because, as we said, everyone's going to get it. All that did was put it off for a while. Now, this is vaccination status and the risk of getting infection. Now, it's a bit of a complicated graphic, but basically that's the same risk as being unvaccinated. That's more likely to get infected. That's less likely to get infected. And what they have here is they have all these different scenarios. First vaccine 15 to 90 days ago, etc. So I looked up my category here, third vaccine more than 90 days ago. So do I have a fifth the chance of getting COVID infection? No. Do I have a quarter the chance of getting COVID infection? No. Do I have a third the chance? No. Do I have a half the chance? No. My chances of getting COVID infection are virtually the same as if I'm unvaccinated after 3 doses, if it was 90 days ago. So I thought that was quite an interesting graphic, really, showing the waning of the protection against infection, particularly now we are in Omicron. And this was interesting also. This is the protection if you're previously infected. So pre-alpha variant period, you've got that much protection. Alpha variant period, that much protection. Delta, that much protection. So half to a third is likely to catch it. And of course, this does not contain the data for the Omicron. So I would suspect that if you've had Omicron, your chances of getting Omicron are really very low. In fact, we know it's pretty low. So I would expect the Omicron and Omicron line to be way down here somewhere, but we don't have that data yet, or at least the Office for National Statistics don't record it. Now, what is absolutely deafening by its absence is the Office for National Statistics do not say in these people that have had natural infection whether they've been vaccinated or not. I mean, how can that mean anything if we don't know whether these people have been vaccinated or not? Really quite incredible. But we do know that data from the state shows that if people have had the natural infection, whether they're vaccinated or not doesn't actually make too much difference. So maybe the Office for National Statistics have included it because it doesn't make too much difference. But we are seeing definitely protection against, and this is just infection, of course. It's not telling us about severity, but less likely in people that have had previous infection. Do we have some more pictures? No, that's all we've got for now. Okay. Let's go back to look at some more of the Office for National Statistics data. Deaths involving COVID-19 continue to fall. This is the week ending the 18th of February. 969 deaths in the week, 217 fewer than the previous week, so they are going down. Deaths are definitely going down, which is good news. Now, here we have the COVID symptom tracker app. And again, this shows the high prevalence. So 2 million people currently predicted to have symptomatic infection, 162,000 cases in the day. 162,000 symptomatic cases, new cases in the day. And here we see the overall numbers, and here it's and this of course is live data. This is the most modern data. Here we see it's basically flat. It's basically flat. It's not showing the uptick that we saw with the official data based on testing. So I suspect actually more tests are being reported, because this is usually pretty reliable data and it's not showing an uptick at the moment. It's actually completely flat. But getting back to deaths, total deaths in the week, 12,742. But this is well below the 5-year average. 6.4% is a lot below the 5-year average. So less people are dying overall at the moment in the UK, which is great. Of the 863 deaths registered where COVID was mentioned, 64.8 recorded COVID as the underlying cause of death. In other words, the rest of these, the other whatever it is, 35%, they're incidental findings. So what this is saying is 64% of these deaths died from COVID. The other 35% died with COVID. So we see that the proportion dying with COVID is increasing. Now here's the Office for National Statistics thing about antibodies. And it's just incredible. Presence of antibodies, previously had COVID-19 infection or been vaccinated. Well, which is it? They don't tell us. They don't tell us. Because, of course, by testing for particular antibodies, you can tell whether someone's had the real infection or whether they've had the vaccine. And the Office for National Statistics don't tell us that. So this is telling us virtually nothing. It tells us virtually everyone's got some kind of antibodies. But how many of those are natural immunity? And how these are going up. What I want to know is, okay, we know a lot of people have got vaccine-induced immunity, but to what degree is well, let's have a quick look at it actually, because we know that when we look at the virus here, we could find nucleoplasmid antibodies, for example, or membrane antibodies, not just the spike ones that are only caused by the antibody. And it would be simple enough to test for these, but the Office for National Statistics is just giving us the overall figure, whether it's that one. I don't know. They just don't give us the figure. In fact, the fact that they can't differentiate means that they're just testing for the spike protein antibody. So why aren't they testing for the nucleoplasmid and the membrane protein or the envelope protein, so we know who's had the natural infection? And as I say, given the amount of money the Office for National Statistics is getting paid for producing this data, it is a bit disappointing. So it doesn't tell us very much, actually. Long COVID continues to be a problem. As of the end of January 2022, 1.5 million people, 2.4% of the population living with long COVID. That's with a definition of over 4 weeks. But 45% of those have had symptoms that last for at least a year. Now, this is self-reported. This is self-reported COVID. So there will be some people here who might be misinterpreting their symptoms. Or some people here who are reporting symptoms when they don't actually have symptoms. We need more on it. This is just based on self-reporting. We need some more objective criteria, an assessment tool really for this. 65% of those with self-reporting long COVID say it's affecting, so of those that say they have long COVID, 65% is affecting the day-to-day activity, fatigue being the main feature. The prevalence of long COVID, most common in 35 to 49-year-olds, more common in females, more common in people living in deprived areas, more common in people working in teaching, education, social care or healthcare, which kind of makes sense because does it make sense though? Because you're being repeatedly exposed to the virus there. There's a higher exposure. So you would expect those to have a higher immunity rate as well, but it's not making sense at the moment. We don't have enough data to make sense of this. Those with pre-existing health conditions does actually make sense. So there's the data from the COVID symptom tracker study that we've just looked at. Here, that's the COVID symptom tracker data, and that shows really that things are level at the moment in lifetime. Now, overall here, we do see that cases are going up. But this represents people that are actually putting in their lateral flow tests. So I actually think this is a more accurate measure than this one, because of the unreliability of reporting. In other words, cases are not that good a proxy of overall infections. But let's just look at it anyway, because it's what we've got. So we are seeing a slight increase, well, quite a considerable increase there, at least in people that are reporting their tests, quite a significant increase. But when we look at healthcare, patients in hospital, well, I'm afraid patients in hospital, what are we seeing? Not really an increase in that, maybe very tiny. But patients admitted to hospital, new patients being admitted to hospital, well, there's definitely a slight uptick there. And this, of course, is because the UK reopened on the 24th of February, the end of all legal restrictions. So this isn't at all surprising. Not at all surprising that this has happened. But it's pretty minimal. And if we look at severely ill patients, of course, we see that basically the downward trend there is continuing. So given that the lifting of legal restrictions will have caused more community mixing, it's not surprising there is this slight increase. Deaths-wise in the UK, well, what are we seeing? Well, I think basically we're seeing deaths within 28 days of a diagnosis here. Look at that a bit closer up. The downward trend is certainly there, isn't it? That's the Omicron wave there. And if we can compare that to previous waves, we'll see it's thankfully much lower, the number of deaths. And of course, this is deaths within 28 days of a positive test, whereas the Office for National Statistics, of course, is death certificate data. So I'm going to leave that brief summary there. To summarise, regardless of the country we're in, we are seeing more mental health in people with long COVID, at least in younger people, which is a concern. We are seeing a fair proportion of people with long COVID. We don't know yet the likelihood of getting long COVID with Omicron. That data really isn't through yet. So there's a few unknowns still to work through. And we'll keep an eye on that with interest. Now, just to finish, we were looking at Hong Kong there. And I've got an email here from Anonymous in Hong Kong. As you know, the outbreak here has been crippling, and the government has doubled down on its strategy of eliminating the virus through its plan to test every single inhabitant of Hong Kong. But he goes on to say, if we test all these people and we get huge amounts positive, then there's not going to be the quarantine facilities for them, because people testing positive in Hong Kong are physically quarantined away from home. New quarantine facilities are being built or were recently completed, but I suspect they will not be able to quarantine everyone. So what they're doing there doesn't really make too much sense. Hospital authorities here are burnt out and exhausted. Hospitals are full. This is because there's a large proportion of older people not vaccinated, and they're the ones that are greatest risk. It depressingly feels like we're basically travelling back in time to the early stages of the pandemic in 2020, while the world has moved on. Why this outbreak has been exceptionally severe: poor vaccination amongst the elderly, as we've mentioned, coupled with absurd fake news stories. So, for example, there was a fake news story: American government's trying to exterminate Chinese people. I mean, how anyone could believe that, I have no idea. Although, I mean, the other thing that was mentioned there was a lot of the Hong Kong government initially had to be commended. Let me just read out the paragraph. Poor vaccinations amongst the elderly. When the vaccination drive began, the government, in the interests of transparency, publicised data regarding suspected adverse reactions. Now, they were suspected, not all of them were true, but that did seem to put a lot of people off. Whereas we're only just getting a lot more data on adverse reactions now, so we could argue about that one, couldn't we? And I am still trying to work out whether I'm allowed to tell you about the Pfizer release papers or not. It's unclear whether they're legally protected at the moment, but more on that shortly. Many people opted to get the Chinese Sinovac vaccine, which we know was not as efficacious against Omicron. There was economic fears of disruption, so sometimes the government were locking down, sometimes they weren't. I know many people that don't want to report that they have COVID symptoms because they'll be moved to a quarantine facility. So if you're going to be moved to probably not the most pleasant quarantine facility, then you might be more than tempted to keep quiet about your symptoms and not get tested or not report a positive test. There was a lot of complacency from previous success with COVID zero policies. Same in China, they did very well, but Omicron is a different thing. It's so much more transmissible. Chinese authorities also maintain a zero COVID policy, and it's essentially obvious that our leaders want to align our COVID strategies with our compatriots in China. Different situation, really. Density. Poor people are forced to live in illegally subdivided flats with other households. So several families in one household. Many outbreaks have emerged in public housing estates and low-income housing blocks in the Kowloon area, with families sharing flats. I feel letting the virus rip would have been more disastrous owing to the poor vaccination rates and cramped living conditions of many of the residents here. According to Anonymous, we could argue about that. Anonymous says, I'm personally not opposed to zero COVID, but the government seems to be torn between allowing normal life to function and towing the zero COVID goal of the Chinese government. Kind regards, Anonymous in Hong Kong. So, unfortunately, there's going to be quite a lot more deaths in Hong Kong because of the low vaccination rates in the older age group. For the rest of us, although there's a slight blip in the UK, I really expect this to peter out really quite quickly, and certainly in the States, cases are going way down, which is encouraging. We're all being exposed to Omicron, so we're developing immunity, so we are well into endemicity, well, we can only say it becomes endemic when it's predictable, so it's still a bit unpredictable, but it's becoming much more predictable. So I think I'm happy to say we're at the very end of the pandemic stage, if not well into the endemic stage at the moment. And probably just as well because, of course, the world's moved on to other news stories, hasn't it? So there we are. I'm encouraged by this pandemic, and I think I think we're moving on to endemicity. I think it's basically good, although there are still people suffering and dying at a lower rate. A lot of people have been asking me about Japan as well, just while I think about it. How come the infection rates and the death rates were so low in Japan? I'm looking at this now. But I have been talking to some people about iodine, which is interesting because the Japanese have a much higher intake of iodine than we do. So whatever it turns out to be, these cross-cultural differences between Japanese society and Western society could teach us an awful lot as we start to look at this data over the next few months about preventing viral pain, suffering and death, as we try and identify the differences and the reasons for the differences between Japan particularly and the UK or the United States, for example. So more to come on that. There's going to be some good things come out of this pandemic. We've been through a lot of bad things, still some bad things to come, but there's a lot of good learning is going to come from it that is going to help people quite a lot, I'm sure. So I go on for too long. Thank you for watching.